I would assume there's a next time. And if you look back, as far back as 1918, when they had the flu pandemic that people talk about, it took 10 months. It came in 3 different waves. And the second wave was worse than the first wave. So even if you put aside all the modern day challenges, when this happened in 1918, it came in 3 different waves. So let's be prepared and intelligent. Today we must consider an outbreak anywhere is an outbreak everywhere. A.J. Parkinson. And I think those are words to remember going forward. Outbreak in China. In a number of days it's going to be in Europe. From Europe it's going to come to the United States, assuming it didn't come from the United States immediately from China. Another lesson we have to learn is our hospital system. So really, your healthcare capacity in the state is all in the hands of private hospitals, right? You have 176 private hospitals in the state. That's the capacity. But that means you have to now rely on those private hospitals, get them all to be part of one system, which day to day, that does not happen. They're operating themselves. We have, again, state regulations that say this is how much you must operate. But they operate as individual entities. In the middle of this outbreak, we had to go back and do what we call the surge and flex management system, where we said to all 176 private hospitals, we have to work together. And we have to manage this system as one. Part of what we have to learn is what happened with the equipment. I mean, this was just a situation that nobody anticipated. It happened all across the country. You couldn't get enough gowns. You couldn't get enough masks. We're going to put in a state requirement now that every hospital has to have a 90-day supply, stockpile, their own stockpile, of all the PPE equipment that they could need for a 90-day supply at the rate of usage that we saw with this COVID virus. So every hospital has to have 90-day supply. We just drove up prices by our own competition. New York State alone buys about $2 billion of medical supplies this year. $2 billion this year. And that's one state. And that's us purchasing from China and around the world. We're going to form a consortium with our 7 Northeast partner states, which buy about $5 billion worth of equipment and supplies. That will then increase our market power when we're buying. And we will buy as a consortium, price as a consortium for PPE equipment, ventilators, medical equipment, whatever we need to buy when you put all those hospitals together, all that public health capacity together, which will make us more competitive in the international marketplace. And I believe it will save taxpayers money. I also believe it'll help us actually get the equipment, because we have trouble still getting the equipment and just buying the equipment, because these vendors on the other side, they're dealing with countries, they're dealing with the federal government. Why should they do business with one state, right, when they can do business with an entire country? So this consortium, I think, will help us get the equipment and get it at a better price. We will come up with a regional identification of all the equipment we need. Basically, it's all standard equipment. A mask is a mask, a gown is a gown. Let's come up with a total amount that we need. Let's stop doing business with vendors who we found to be irresponsible, and we found out the hard way. I can't tell you how many orders we placed with vendors who were acting basically as brokers, who just started businesses in the middle of this pandemic because they saw an opportunity. So let's compare notes among the states to find out who was good to do business, who was not good to do business with. Let's see if we can't do the purchasing in this country. and let's see if we can't do the purchasing in this region. And we'll do it in coordination with the federal government. But I want to thank our neighbors, our neighboring states. The word neighbor has a different connotation. You don't normally think of the surrounding states as neighbors. You think of the person next door as a neighbor, but they are neighbors. And they've acted as neighbors. I can't tell you how supportive Governor Murphy in New Jersey and Governor Lamont in Connecticut and all the other governors in our coalition have been.